მოგწონთ, როდესაც მიგითითებენ თუ როგორ უნდა მოიქცეთ.
მაიკლ ბერნდონნერი, კომუნიკაციის ტრენერი და ბიზნეს ქოუჩი, ციურიხისა და სანქტ გალენის უნივერსიტეტების ლექტორი, შვეიცარია, შვეიცარიის ინსტიტუტი ტრენინგისა და ქოუჩინგისთვის დამფუძნებელი, საქართველოში გერმანიის ეკონომიკური გაერთიანების წევრი.
My name is Michael. I was told to talk about mistakes in communication procedures. I would rather talk about communication procedures that are not very effective or very helpful between patients and therapists. This is Temuri. He is 8 years of age. Temuri has a hole in his tooth. He's going with his father to the dentist's clinic. He asks his father, "Daddy, will it be painful?" The father is looking to the dentist and the dentist answers, "No, Temuri. You will feel a little bit the injection, but after that you won't feel anything." Then she starts the treatment. Later on, Temuri starts to cry. "Daddy, it hurts." The dentist answers, "Well, Temuri, I gave you an injection. It cannot hurt. It will be over in a short time." Here we have Nino. She is 35 years of age. Nino has problems with her gums. She was treated already twice. Last time when she was in the examination with her dentist, the dentist found out that there was not much improvement with the gums. She told that to Nino in a very polite way, yes, but nevertheless Nino felt somehow blamed. She felt guilty. Tomorrow is the next examination date for Nino. She's scared. She's scared to go to the examination date because of the possible reaction of the dentist. She feels guilty conscience and she's scared. What did Temuri learn out of that situation? When it comes to painful situations, adults will not tell the truth. And as for Nino, what happened? The dentist was polite, yes, but nevertheless, somehow Nino felt blamed and guilty conscience. Disregard of basic human needs and communicational behavioral patterns can lead to misunderstanding and even mistakes in communication procedures between patients and therapists. Some people smoke, although they know it's unhealthy. Some people eat a lot of sweets and are overweight, although they know it's unhealthy. Some people speed up while driving a car, although they know it's forbidden and they could get a fine. Nevertheless, they are doing that. This is called ambivalence. Ambivalence is a normal human behavioral pattern in everyday's life. Some of the patients, they know how they should treat their gums and their teeth. Nevertheless, they are not doing that. But this has nothing to do with not being motivated. No, it's a basic human behavioral pattern which is well known in psychology, and this is ambivalence. Everybody of us is sometimes ambivalent. We are doing things, although we know it's not good or we shouldn't do it. So this is one of the behavioral patterns. Let's have a look to some basic human needs. There are, in fact, two. One of a factual level and one on a relational level. On the relational level, we seek for social acceptance and we seek for autonomy. On the factual level, we seek for conciseness and for honesty. What does it mean? Social acceptance means I would like to belong to. I would like to be part of a group of people, a society, a family. Autonomy means I want to decide myself. I don't want to be told what to do. This is on the relational level. On the factual level, conciseness means I would like to be told things clear so that I can understand what you tell me. And the last point is honesty. I would like to believe what people are telling me. Above all, this is important. Factual relation requires relationship. So we need to determine, we need to set up a trustful relationship before we get through with on a factual level. Let's have a look closer to one of these basic needs. It's autonomy. Here we see on the left side, the left arrow, we see the amount of freedom of choice or autonomy somebody can have. On the right arrow, we can see the amount of resistance some people have towards a topic, a recommendation. This is the curve which we need in that chart. So what we see now is the more autonomy people have, the more they can decide by themselves, the less they will resist towards a certain topic or a recommendation. And the less autonomy they have, the more they will resist towards a recommendation. This is what we have to consider about when we work as therapists with patients. Let's have a look to findings in neuroscience and in psychology. First of all, our picture of other people is reflected in our thoughts about them. So how we think about other people reflects how we act towards other people. Our thoughts, though, influence our behavior. So our body language, our voice, our mimic, the way we look, the way we think about other people, the way we speak to them. Our inner attitude is reflected in the way we behave. So Nino again, in the clinic, in the dentist's clinic, she felt blamed, but the dentist was very polite to her. But maybe in a certain reaction, body reaction, the dentist showed that she was angry and she was disappointed of Nino because of not having an outcome of the treatment, an improvement of the treatment. Then we have to look into our brain. Giving people recommendations or to teach them goes better when we give them positive messages. Our brain loves positive messages. And the last but very important thing is people tend to believe their own beliefs more than others. Nevertheless, that they might be experts, they think about what they faced and what they experienced weighs more than that what the expert tells them. These are things we have to consider about when we recommend, when we treat, when we coach other people. Let's have at some cognitive biases and unfavorable behavioral patterns. I don't want to say mistakes. It's not about mistakes. It's unfavorable and it's a so-called cognitive bias. The first one is the so-called writing reflex. Therapists as well as parents, they tend to act with this writing reflex, meaning I know that you have a problem, I have the solution and I'll tell you. Or towards children, I know that you lack of some knowledge and I will fill up your brain with my knowledge. Or I will correct what you did in a wrong way. This is called the writing reflex. The second one is patients usually are not unmotivated, they are just ambivalent. And as we have seen, ambivalence is a normal human psychological pattern, a behavioral pattern, and it's normal for everybody of us. So, as knowing that, we should not doubt what people tell us in terms of what statements or explanations they have. We never know, we as therapists, we never know if this is not the truth. So we should not doubt, and we should not show the people that we are doubtful about what they are telling us. Impatience and stress on the part of the therapist are a big problem, especially in medicine. Doctors are stressed. Doctors are sometimes impatient. This has an impact to the patients automatically. They feel that they are stressed, and they would rather go out as quick as possible than to listen to somebody who is stressed. And the last point is, a noisy and uncomfortable environment is not really helpful when talking to people, communicating to people. So we have seen now the two stories of Temuri and Nino. We have seen the basic human needs and ambivalence. And we have seen now some unfavorable communication procedures. So what could be the way out? The way out is motivational interviewing. Motivational interviewing was established in the 1980s already by Milner and Rolnick in the United States. They are talking about four, let's call it spirits or inner attitudes. It's collaboration, it's acceptance, it's evocation, and it's compassion. They are talking about my inner attitude in terms of that four spirits. Collaboration means my patient is an expert, and me as a doctor, I'm an expert as well. We are both experts, and we're talking to each other on an eye level, from expert to expert. My patient is an expert for his or her own life. He or she knows exactly how she's living, what are her or his problems, how she or he could treat that. Me, as a dentist, I know about the treatment of the gums and the teeth and so on. So we are both experts talking on an eye level. That means collaboration. The next one is acceptance. Also, this is an inner attitude. Acceptance means, first of all, absolute worth. Means I accept you as you are as a human, without any condition. It's not like I like you or I care for you if you do this and that. No, it's an unconditioned worth of other people. Autonomy is the second one. I accept that every other human being is completely autonomous in his or her decisions, and I do not doubt that. The third part is accurate empathy, meaning change of perspective. I try to understand my patient in his or her specific situation, with the family, with the house, whatever it is. And this is empathy. And the last point is compassion. Compassion means I appreciate every little step a patient tries to do towards a certain goal. I appreciate that, and I tell the patient. Even it's a very small step, but for the patient, it might be very important. The third part of these four spirits is evocation. Many of us, many therapists, teachers as well, sometimes parents, they are in the deficit model mode. You can see that in the upper part, in the upper box. Deficit model means you have a problem, I know exactly your problem, and I will deliver the solution. So you just have to follow me and you will solve the problem. This is the so-called deficit model. The problem is, it doesn't work. People do not like to be told. This is what we have seen as a basic human need. So what would be the solution? It's the evocation model. The evocation model means you know actually everything what you need. You have it already in your thoughts. You as the patient, me as the therapist, we will find it together. That's the idea of the evocation model. The last of the four spirits is compassion. Compassion meaning of I do care for you, and I try to do my utmost that you feel well, that you have the welfare, that you feel comfortable in my clinic when I'm going to treat you. So we have seen now possible problems in communication procedures. We have seen a possible way out of that. What is now the strategy? A possible strategy is, first of all, to establish endogenous conditions, exogenous conditions, and communicative conditions. What does it mean? Endogenous means I have to understand myself, first of all. How do I act and react in my normal life as a therapist, as a dentist, for instance? What do I think about other people if I see that they don't have healthy gums or they have problems with their teeth? What is in my mind? Do I judge or not? So this is endogenous conditions. Exogenous conditions means the environment, my clinic. Do people feel comfortable where they are? Is it noisy, or do they have a good environment to talk with you as a dentist? And the third one is communication procedures. Find out what are the good, the helpful communication procedures with your patients. So what is the path to success? First of all, it's positive attitude. Talk to the patient on an eye level, from expert to expert, also to children. The children will be your future patients. Positive thoughts. Don't judge other people. Strengthen every little success. The way we think about other people is the way we speak to other people. And the third one is positive environment. Try to enable the patient a quiet and trustful environment for the visit at the clinic, for the discussion, for the communication procedures. How to do that? Enable your teams, enable your people in your clinic, reflection and training.